As our sun declines, our need for safety and assistance increases. Choosing appropriate and quality care for an older adult often requires sifting through the good, the bad, and the ugly. Do you know which care option is right for your loved one? Do you recognize the signs of a quality in-home care provider? To ensure that your loved one will be safe, healthy, and happy, do you know what questions to ask of a prospective in-home care provider? Do scam artists target older adults? Hello, my name is Attorney Ramsey Bahrawy, and welcome to Your Money, Your Life. Today, my guest is Nancy Coulter, President and CEO of Senior Options. She also created Starfish Resources, LLC, to educate the public on resources available to seniors. In addition, she authored A Pathway to Senior Care in San Diego, in which she reveals the ins and outs of the industry. Nancy, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you. It's great to be here.
Now, there are different types of agencies. There are home health care agencies, and then there are other agencies that don't provide the health component. Can we talk about these different agencies, what the difference is? Because my impression from talking to my clients is there's a big misunderstanding. They think they're all the same.
Well, they're not really all the same. I know here in Massachusetts, the VNA is a popular name that you hear with home health companies. And because they use VNA, which is Visiting Nurse Association, it is thought that they are all the same company, but they're not. They're all owned by different and various, some have hospice, some don't. So it is very different. Some are associated directly with hospitals. And so there's another difference for you. The primary difference between home health and home care is that home health is usually covered by your insurance. And you usually need to have a doctor's order in order to receive care from a home health agency. They may have private duty available under their umbrella, and that would be paid privately, which is why they refer to it as private duty. Home care companies are all private duty and are not covered in any way, shape, or form by your insurance. Unless you have long-term care, that might pick it up.
Okay, so you just mentioned that home health requires that, first of all, that a doctor order it. How frequently can somebody receive these home health care services? Are we talking daily, every other day, once every 3 days, once a week, once a month? I mean, how often are you entitled to these services?
It's determined by the doctor's orders.
Okay.
It's rarely daily. Usually you get a nurse come in once a week, and they might send a home health aide in 2 or 3 times a week. They may send in physical therapists and occupational therapists to help you adjust to being in your home with whatever ailment you're dealing with. But it is completely determined by the doctor's orders.
Okay. And of course the doctor has to make a determination that you're homebound, that you can't go out. In other words, you can't go visit your own physical therapist or occupational therapist or nurse or whatever the case may be.
That is correct.
Okay. So to summarize, you have to be homebound. There has to be a doctor's order. It's likely paid by either public or private insurance. Is there anything else that we need to know about home health care services?
No, I think that pretty much sums it up.
Okay.
But you do want to make sure whenever you're dealing with a company coming in, you want to talk to them and interview them and make sure that they're going to be the right fit for you. You want to actually visit with the nurse maybe before they get you signed on for services and make sure that that relationship's going to work, because everyone has differences in their personalities and you want to make sure it's successful. So it's a good idea to interview those that are going to be coming into your home and making sure that you're comfortable with that.
What sort of questions do you think a person should be asking of a home health care provider?
Well, for home health care, you want to know their scope of practice. You want to know, do they provide physical therapy and occupational therapy? Do they have home care, private duty available?
So let's talk a little bit about private duty. How is private duty different from the way you described home health?
With private duty, they can assist you with bathing and dressing, preparing meals. They might be able to help you get to the doctor's office for visits. They can drive for you, that type of thing. They're really doing more companion type services, not so much health services.
Okay.
And they are paid strictly privately, as I mentioned before. There's no insurance other than possibly if you have a long-term care insurance policy that will cover home care. The difference in the agencies varies greatly. There are some agencies out there that really don't want to provide the proper insurances and such for their staff. And they may be a little cheaper. You want to make sure that they have their workman's compensation and their bonding insurance, because if that caregiver gets hurt helping your mother could end up losing her house if there's no workman's compensation insurance provided.
You know, that's an excellent point that you make. The property owner has liability for any injuries that occur on the property if there's some sort of defect on the property. So you've got an excellent point. You want to make sure that somebody that comes in to the home is going to be bonded and insured, and also understand that homeowners insurance policies oftentimes have an exclusion for any domestic workers.
Right.
And this person would be classified as a domestic worker. So even if you have homeowners insurance, you'd be subject to the exclusion, and I think that's where your comment of you might lose your home comes in.
Exactly.
Yeah, yeah. It's a very good point. I'm glad you brought it up. Okay, so you mentioned earlier that health home care requires a doctor's order.
Yes.
Private duty require a doctor's order?
No.
No. Okay.
Not at all.
So basically the person that requires the care can choose whatever facility, whatever agency they want, and they can choose how frequently they want the service.
Mm-hmm.
They don't need a doctor's order.
No.
But they have to pay out of their pocket.
Yes, they do.
Okay.
And the pricing on that does vary a little bit. Generally, it runs $24, $25 an hour. One of the other questions that you want to ask when you're interviewing the company that you're considering is, how do they handle call-outs? What happens when you have a caregiver scheduled to be at your home at 8 o'clock and they're not there at come 9? Who is going to take care of that? And how are those caregivers overall supervised? Is there someone that comes to the house and checks in on them and makes sure that they're doing their job, and not just sitting there watching TV and eating bonbons while mom is laying in bed sleeping all day? So there are things like that that you need to be careful about.
I think that's a good place for us to stop. The number of Americans over age 65 is increasing dramatically. The effects of aging, such as reduced vision, decreased muscle strength, reduced mental processing, increased risk of falls, and reduced mobility is likely to affect each one of us in some way. As such, deciding where to live in our senior years is influenced by factors such as our health, family assistance, personal finances, and home modification. Scams abound at any age. However, older Americans are more vulnerable to financial exploitation. Be aware of telemarketing scams, identity theft, fake check scams, and home repair fraud. Take steps to minimize the risk of becoming a victim of any such scams. Also remember to educate yourself about resources available to seniors. A good place to start is by visiting and touring both the senioroptions.com and starfishresources.net websites. Visiting these websites will make an appreciable difference. In closing, I'd like to thank my guest, Nancy Coulter, founder and CEO of Senior Options, creator of Starfish Resources LLC, and author of A Pathway to Senior Care in San Diego, for her participation on this program. Nancy, thank you.
It's been a pleasure.
Pleasure's been all mine. And thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, Building Your Trust.